Hello, so I'm Erin Taylor. It's September 29th, 2022, and today I'm here to talk to you about the no, yes, the skin. We'll get into the epidermis. We're kind of talking about the integumentary system, which has the component of the skin and then the component of the accessory structures, right? So that's going to be hair, nails, glands, so on and so forth. And when you think about the skin, you might think that it's just the epithelial tissue, right? Because epithelial tissue covers the outside. Yes, that's true, but actually all four types of tissue are present in the skin. So you have the muscle tissue, smooth muscle tissue makes goosebumps, things like that. You have the connective tissue, it gives the skin strength. There's really a lot of connective tissue. And then you also have nervous tissue, right? Sensory nerves. That's how we get information from the outside. Um, when we think about the skin, there's technically three layers. There's the epidermis, the outermost layer. The dermis is the lower layer or deeper layer. And then underneath that, we have the subcutaneous layer, which we'll get into, but um, kind of a connective layer. So let's go through each of these. So the epidermis is the outermost layer of skin. Um, and it has five layers, right? So we'll go from the innermost to the outermost. The innermost layer is called the stratum basal. The stratum basal has a lot of stem cells, right? And the stem cells are constantly regenerating. Their mitotic rate is quite high, right? This is because skin constantly it needs to be resilient. It's constantly regenerating itself because of, I guess, friction and stuff from the outside, right? The next layer is stratum basal, stratum spinosum. The stratum spinosum also has a high mitotic rate, not as high as the stratum basal, but still pretty high. And it's going to have thicker layer than the stratum basal, and the cells are quite like keratinized, right? But it's still regenerating. The next layer is the stratum granulosum. So in the stratum granulosum, this is going to be the last layer where you have cells that are still alive. They're going to be dead in the other layers. It's the last layer where they have nuclei. That's a nuclei, sorry. And they are going to die in this layer. So what's going to happen is they're going to excrete like a lipid substance, which is going to make diffusion impossible. That's going to kill the cells so that we're ready for the next two layers. So the next layer is the stratum lucidum. Stratum lucidum is only present in thick skin. So palms of hands, soles of feet, kind of gives them a little bit more strength. And it's quite thick. It can be actually 6 times thicker. That kind of skin is called thick skin, 6 times thicker than thin skin, which is bananas. And then the fifth and last layer, so that's going to be dead cells. These are also dead cells in the last layer, which is the stratum corneum. One way you can remember it is that the cornea is in the eye, and you can see the stratum corneum. At least that's how I've been remembering it. A little goofy, but it works. So that's kind of the last layer of skin cells, right? They're quite resilient. There's a lot of keratin there. So the cells, it takes them 15 to 30 days to travel from the innermost to the outermost layer, right? Then we get the dermis. The dermis has two layers, the papillary layer and the reticular layer. So the papillary layer is going to attach the dermis, and the epidermis is going to have like and it's made out of connective tissue. It's going to have some blood vessels, but not a lot. Then the reticular layer is it's going to be connecting as well, right, to the subcutaneous layer, but it also has a lot of it has hair follicles, it has sweat glands, it has sebaceous glands, it has blood vessels. It kind of, is holding all of that stuff in. So there's really a lot going on in that layer, right? And the layer underneath that, which is its own thing, is the subcutaneous layer. Technically not the skin. It's anchoring the skin to the what's underneath the skin, and that layer is also called the hypodermis. It's often where medication and other things are injected. Oh gosh, I'm running a little long, so I'm going to talk kind of fast. So the last thing is the clinical application. So I'm going into OT. At first, I wasn't exactly sure how to apply skin in OT, but I spent some time doing research, and I learned that in older patients, it's actually kind of quite common for them to have like skin deterioration that affects their ADLs, which is activities of daily life. and OTs can do intervention kind of to help with that. So an example, you might think of like bed sores or other things when your skin is quite tender and it affects your activities of daily life, and the OT is going to help you think of solutions, right, to kind of reduce that injury to your skin, especially if the pain is giving you issues. I've definitely gone over time. Sorry about that. But yeah, that's the skin, and sorry for going over.